Hi again. In this episode, I'm going to talk about aftercare after Mohs surgery after I got home. If you recall, I had the bandage with me for starters, but they give you these instructions for the first 3 weeks and for the 3 weeks and thereafter up to a year of what to do. As far as pain, Tylenol, they said every 4 hours. I did not need it every 4 hours. I was more 6 hours or as needed. But what would happen is I would suddenly feel tired, and in the first day I slept 3 times, and you feel a dull ache. So it wasn't a sharp pain, which was great. And for the first day, you have to keep this bandage on for 24 hours. And basically this applies pressure on your wound. And you can take it off afterwards and check for bleeding. There was very, very little bleeding, just a drop of blood. And then what you need to do is essentially clean it with saline and a Q-tip, where you just take out any blood or weeping. I had no blood, no weeping. And then after that, you apply an antibiotic. She was very much against polysporin. She said never use polysporin. So this is called Fusidin, and it is basically an antibiotic cream. You do it twice a day. It's really easy and quick to do. And another thing I did was, because I wear an eye shield when I'm sleeping and I have the ointment on, I wanted to make sure that I didn't do 2 things. One, accidentally rub my face or rub the cream against the pillow. So I made myself, using a pair of scissors, one of these, by cutting this in half and essentially putting it across my nose and cheek, and it would hold the skin closed up so that I didn't pull it when I was sleeping. Or if I went to scratch my eye, which happens a lot in the middle of the night, I'd run into this and I wouldn't accidentally pull on my skin. And that was kind of my own homemade little thing, which was super helpful. I slept great. I could put my eye shield on. I also used it for getting exercise. Now, you're not supposed to exercise and raise your blood pressure to a level where you have a cardio. But whatever exercise I did, I kept it below the cardio. But if I was outside somewhere and, you brush against a tree or something, I kept one of these bandages across my face with some protective glasses. So just in case you've got a blackberry bush or something hanging out. Now, people have asked me about my skin, and they say, oh, you have really, really great skin. It's wonderful. And I tell them, well, it's only good because I manage it. And what people don't know is I have rosacea. Rosacea means blood vessels burst all over your cheeks, especially in your nose. And I've had this problem for many, many years, and it also peels a lot. So the first few days after the surgery, my skin was peeling like mad. It's like there's trauma, it's peeling. And what I've done with rosacea, about 10 years ago, I discovered there was something that would help, because I tried everything and nothing would work, is something called intense pulse light. And so every year I do 3, maybe 4 treatments of intense pulse light on the areas with rosacea, which really, really help basically shrink the blood vessels that are burst and keep the peeling from being really, really bad. IPL is not painless. It's also expensive, but it has kept the rosacea at bay. Now, IPL also, as it turns out, it tightens your skin and it reduces sunspots. So that is the story of my skin, and why it looks good now is because I've been treating it for rosacea all these years, but the side effect is it keeps your skin looking tighter and whiter. And as far as after 3 weeks, I will be basically massaging the area. I won't have to put ointment. I won't have to put cleaner on it. And I can resume cardio after 14 days. That's the period they gave me, where I can do more and more cardio. I was also told not to do certain poses in yoga, which I don't do yoga, but essentially they don't want you lowering your head, below your waist to get the blood into your head, which is bad for the wound. And that's pretty much it. It's been fairly easy going for me. The swelling went down really, really fast, and I've been so grateful for the great work the surgeon did. And it's, as I said earlier, healing wonderfully. So thank you for watching, and bye for now.